Hi, everybody. It's me. It's Dr. Kessler from Lorraine County Community College. And this is the first co-video of 2021. Today is January 1st. And it seems like I've been doing these co-videos for years now. I want to talk a little bit about vaccines today because that's an interest that everybody wants to continue to hear about. And I'll talk more about it. Treatment. A lot of what's going on right now in the terms of vaccine and treatment has to do with delivery. That seems to be the most important thing right now, and getting it to the right people in a really good amount of time. So that seems to be a big kind of an issue here. And then I will address a lot of what I'm going to talk about today is the new variant virus that is been seen in England and now in many places all over the world. I am certain it is in the United States and it is moving through the United States population right now. And I do have some concerns about that. First of all, my temperature today is 36.6, and that is 97.9 and in Fahrenheit. Okay. So, first of all, let me talk about some sort of good news and sort of not so good news. First of all, you'll notice what's going on the this is the map, not the map, but the curve showing you the number of new cases of SARS-CoV-2 that we have out there, and you can see that even though the number, if you take the average over the last 7 days, the number is depressed, but you can see it is turning back up again. Like what happened, you'll notice over in November, you'll notice that there is a similar dip, which was really just a dip in reporting around the Thanksgiving holiday. I think that that's what's going on there. That may be also compounded by the fact that we are going to start seeing some cases of spread that occurred during Christmas. And in 1 week, we'll see the cases that are spreading from New Year's. I mean, I think we are, this is good. If you look at the numbers in Ohio, we have gotten much better. It's all red. I wouldn't have said that 2 months ago, that this was a good looking map, but it certainly is a good looking map relative to late November, early December, and all the way through the middle of December. Things were quite serious back then. So it's lightened up a little bit, but trust me, I think we are still very much in a very big outbreak, and it may even become worse based on the new strain. One of the things I want to point out is that we don't seem to be getting vaccines to the right place, into arms. We don't seem to be getting them in arms fast enough. I think there is a good deal of acceptance of vaccines. I think that is a good deal, and as you can tell, people are fighting over vaccines. That's the good news there, because when you're fighting for it, it has value. There are people, physicians in New York State, New York City, that are fighting over the vaccine. So we know that acceptance, at least in the hospitals and in the people working in the hospitals and healthcare facilities, those folks are all pretty good about the vaccine. So this is not a matter of compliance. It is a matter of distribution, and this is a logistic problem we have here, and this is something that we should easily be able to solve. You'll notice the amount of the distribution of vaccines. You can argue that we didn't get as much vaccine as we should have gotten. That's fine. What I'm more concerned about is that the vaccine we're getting doesn't seem to be used right away. Now, these data are from last week that you're looking at here, and I'm looking at the map of the United States here, and the number of shots that were distributed and the number of shots that were given. You can see that there's in the state of Ohio there's almost 300,000 doses, and only 50,000 found their way into people. So we have to get on this. We really, really do have to get our stuff together to get this so that we're running out of vaccine and we're constantly replacing it. This is not a manufacturing problem. This is not a science problem at this point. This is purely infrastructure, distribution, and that's what's going on there. You can see that everybody in on this map, everybody's lagging. With the exception of, you'll notice the Bureau of Prisons has not very many vaccines. They haven't gotten very many vaccines, but they've used them, and that's the way it should be. Use them as you get them, and then there'll be more coming. We're behind in the Veterans Office, Veterans Affair, in most of the states as well. So this is something that we have to keep on and keep reminding people that we want vaccines, because there is demand. People want their vaccines out there. We also have some good news. I'm not going to talk too much about this, but we have some good news. There's a new vaccine that has been approved in England, and this is the Oxford vaccine, is what you've heard me talk about it before. And the good news about the Oxford vaccine is this: it is cheap and it is easy to distribute because there is not as stringent a requirement for refrigeration as you see with the RNA vaccines. This is a viral vector vaccine, does not quite have as much effectiveness, but I do like the fact, a couple things about it. It's cheap, and that is always an important thing. Cheap means it's more likely to get where it needs, to get to the people who need it, especially poor people. Cheap is a good thing to have. And here's the other thing. They've already made a lot of it. So they banked on this being a very important vaccine early on, so they have made a lot. There may be 50 million doses ready to go now. So this is a vaccine that can serve the purpose in a lot of different areas. So that should help us get rid of this problem. And we really do have to really work hard now. I know we're tired. I know it's been a long time. And it seems like it has been years. After today, it's been years that we've been working on this situation. Well, not quite one whole year, but you know what I'm saying. We do have more to go here to get this all done. I'm also very confused about something else that's going on. There's a treatment out there. This is not a vaccine, but a treatment for people who are in the hospitals. Their hospitals are over full. And for logistic reasons as well, we are not delivering monoclonal antibodies to patients. Monoclonal antibodies is what President Trump got when he was sick. Also, Chris Christie, Rudy Giuliani, all of those folks got that, and this is the thing that has kept them back on their feet and got them going, because all three of them have comorbidities that should have knocked them out a bit more. And apparently, there is only 20% of the drugs that are available are being delivered, and so that is something that we need to work on. We could be lowering the population of the hospitals with the monoclonal antibody therapy. So that is something that we do have to worry about. Distribution. The science has done its job. Now we have to do it to the logistics of the situation. We need to get it into people. I want to spend the rest of the time talking about this new variant in England, and it does seem to be spreading quite fast. And England is trying to deal with it, and it is quite serious. It is called it has a very funny name, the B1.7.1.1.7 variant, and it is, from what we can tell, more infectious. The R0 number goes up for this virus, which means there are more cases. It is not more deadly, but I'll remind you of this: more people getting infected means more people will get sick. More people will have a fraction of those will have serious problems, and so it is something that we need to be thinking about. And I am certain at this point, I think I said this already today, but I'll say it again. I am certain that this virus is circulating in the United States at this moment. So we have to assume that. I want you to notice that this virus, this may be a coincidence. This may have nothing to do with the other, but there are two pieces of evidence here. The variant first comes out in the middle of October. We first start seeing it in England in the middle of October. And it picks up. I'll show you the data about how it picks up towards December. It is still not the number one virus that is circulating around England right now, but it is a major player. In a very short period of time, it has become a major player in the virus population. And so the interesting thing, this is a little cartoon here showing you the SARS-CoV-2 virus, and you can see the variant has a number of mutations. Some of them are in some open reading frames that are unassociated with the spike protein. There are a few within the spike protein, and some outside of the spike protein. The spike protein, as you guys remember, is so important because this is the thing that picks the lock that gets into your cells. The spike protein, the little reddish projection off of the virus. The reason it's called a coronavirus is because it's got a crown, and that is the thing that is also immunogenic. Is also, you can block it. If you block it, you can block infection. So there's a few variants in there, so it is getting into people more efficiently. Will the vaccines cover it? We have no evidence that it will not. I will point out that there has not been an increase in the number of people who've gotten second infections. Rarely you see people who get COVID twice. It's not a thing. It's a rare thing. And that frequency has not increased in the last month. But trust me, we're looking at that. If that does increase, then we start to think that maybe this is not protecting the original virus immunity, is not protecting against the second virus. That would make this an escape mutation. An escape mutation means that it escaped immune detection, and that would be incredibly scary if that were to occur. But again, we're not there yet, so that's not something to worry about. We need to, though, be very cautious and concerned about it. The European Union has their own Centers for Disease Control, and they have been looking at this and studying it. They've been sequencing a lot of full genomes from people all over England, and what they have noticed is that the variant population, this variant that we're studying, is on the blue line, came out about middle of October, and then by the end of, or the middle of December to mid-December, you see it is approximately 10% of the isolates. So it is still a minor. 10% is minor, 90% would be the major. It's still minor, but you can see the slope of that curve means it's gone up probably a couple times since this data was taken. So it's got my attention. I just want to point that out. It has also got my attention because it has now been seen in Florida, it has now been seen in Colorado, and it has now been seen in California, were the three places. And I just drew this on a map showing you where they've been isolated. So I am kind of certain, I'm fairly certain that we're going to see more cases of this particular version of the virus in upcoming weeks. In fact, at this point, we are now looking at 32 countries that have this particular more contagious virus out there. So the thing is that we have to get moving. We have to get moving on getting the vaccine out there. Mutations in virus in general occur as a consequence of replications. More replications more possible mutations. And so we need to get control of this virus and bring it down so that this does not continue. The reason that it is happening is because there's lots and lots of replications out there, and this appears to be a better virus from the virus's point of view. If you look at this from the virus's point of view, it is better to be more infectious. So now that we're at this stage, we really need to be very careful in the next few weeks. We need more precautions, not less. I know everybody's thinking vaccine, yay, we have a vaccine coming. It's not here. It is clearly not here. We need to wait for it. By the way, if this vaccine does not cover the new variant, we are working on that as well. That is something that can be adapted to all of the vaccines. Probably the mRNA one's the best. It can be converted. So we need to I know it's long. It's been a long, hard haul, but we're almost there. We are on our way. There is a vaccine. There's 3 vaccines out there. They seem to be doing the job. They have pretty mild side effects overall, and we need to wait for that to work. So stay cool, everybody, and just remember to be a helper. And the helper right now, the best thing you can do is to keep other people from getting infected. I have heard some terrible stories over the holidays about people who were lost, who were not in the usual groups that you would have expected. Some people who were lost that were young people. I just heard of a story of a second-year law student, 25-year-old kid from was at Harvard, and that's a full life lost right there. So we need to just to be the helpers right now for everybody. Keep that social distance. We haven't beat this yet. For those of you who've got your vaccine, remember you need to get your second dose. That's a very important thing. To be the really good helper. I know we Americans kind of like, we kind of like go in and say, yeah, I'm good enough. I washed my hands. 1, 2, 3. We've all learned how to wash our hands. We all learned that it's kind of a big deal of you wash your hands, you do your ABCs, etc. We need to be that way for this event too, until we get through this. And like I say, I see the end. We will get through, but be good to each other. And may you persist like a lentivirus. Thank you, and have a Happy New Year.